Hi everybody, I'm going to be talking about smoking and why you shouldn't smoke. First, the cosmetic reasons are smoking ages you. The effects include aging in the skin, fine line around mouth, crow's feet, and it makes you look older. 1 in 2 lifetime smokers will die from their habit. Half of these occur in the middle age. Many of the health issues, the mixture of the nicotine and carbon monoxide temporarily increases your heart rate and blood pressure, and that causes a stroke and heart attacks because it strains your heart and blood vessels. Some of the diseases that smoking causes is heart disease and emphysema and COPD. COPD is known as chronic obstructive pulmonary disease, and I've known a lot of people who died from this. Emphysema is an illness that slowly rots your lungs, and you usually develop bronchitis over and over again when you get emphysema. Smoking can also cut off your blood circulation, and you can also get your limbs amputated if it gets bad enough. Men who smoke are 10 times more likely to die from lung cancer than non-smokers, and actually heart disease causes 1 in 5 deaths. On quitsmoking.com, there was a foreword of the Surgeon General warning in 1982, and he declared that cigarette smoking is a major cause of the lung, larynx, or cavity, and esophagus, and it's a contributory factor for the development of cancers in the bladder, pancreas, and kidneys. Secondhand smoking is also known as passive smoking, and non-smokers exposed to secondhand smoke are at greater risk for many of the health problems associated with direct smoking. In 1992, the American Medical Association published a review of evidence regarding secondhand smoke, and that over 40,000 people die from secondhand smoke. They weren't even smoking and they die. Come on! Exposure to secondhand smoke increases the risk of heart disease by 60%. And there has been controversy over whether secondhand smoke causes these cancers. Some researchers say that it's junk science, but there has been moderate occasional exposure to secondhand smoke that presents low cancer risk. And the risk goes up if a non-smoker works where cigarette smoke is prevalent, and that's why a lot of jobs and a lot of businesses have a no smoking policy. I know my job has a no smoking policy anywhere on campus, and you can get fired if they catch you smoking. But they also offer free counseling and free therapy. For children in secondhand smoke, the 2006 Surgeon General warning reports that secondhand smoking causes premature deaths in children, respiratory infections, ear problems, severe asthma, and it's not fair for the children to have to inhale the smoke. My mother quit smoking cold turkey when I was 2 or 3 because it was getting in the way of our relationship, so she just quit smoking. There are many ways to quit. First is cold turkey, like my mother did. Some people have a hard time with this, and so it takes several attempts, but you just start over. There's also group therapy sessions, counseling, prescription drugs, nicotine patches, self-help books. The most successful self-help book has been the Alan Carr's Easy Way to Stop Smoking. Many people fear weight gain when they stop smoking, but there's a book out there called Quit Smoking Today Without Gaining Weight, and it comes with a CD, and so that can help. Alternative therapies are acupuncture, laser therapy, and hypnosis. There are health benefits as soon as you quit smoking, and I found on quitsmoking.com, within 20 minutes, your blood pressure and pulse can return to normal. In 8 hours, your oxygen levels return to normal. 72 hours, your breathing becomes easier. 12 months, your risk of heart disease is reduced by half. 5 years, your risk of heart attack fails to about half of that of a smoker. 10 years, risk of lung cancer fails to have about that of a smoker. And smoking benefits everybody around you, your family, your kids, your coworkers, your friends. And I also found a little tidbit in Cosmopolitan for the women out there. Another good reason to stop smoking is that smoking raises your risk of PMS. With the bloating, the tenderness, the mood swings, it can make it even worse. And that's because PMS is triggered by changes in hormone levels, and the toxins and nicotine can make these changes worse. So that's another reason why you shouldn't smoke. But you should also stop smoking for yourself. And that's all I have about smoking.